The decisions we've made are tough, but they're consistently moving in step with the escalating COVID-19 crisis here in New Hampshire. Today, I'm announcing 3 significant actions in our continued response to COVID-19 that will be officially released tomorrow morning. First, the state of New Hampshire will be issuing a stay-at-home order and directing all non-essential businesses that have not already voluntarily closed to end in-person and public interacting operations by midnight, Friday, March 27th. Over the past 24 hours, we've received calls and requests for a mandatory shelter in place. This is not a shelter in place. We are not closing down transportation. I'm not closing our borders, and no one will be prevented from leaving their home. I want to be clear. No governor can shut down their border. No governor can prohibit another state's residents from entering their state. But in taking these actions, we're aligning with our regional partners who have issued similar orders. We all know that New Hampshire and Massachusetts are closely intertwined. Our businesses, our families, our communities. And in an effort to be consistent across the board, we're taking today's steps to align with our regional partners. I'd like to add some clarity as to what is deemed essential. Healthcare facilities, gas stations, grocery stores, convenience stores, hardware stores, homeless shelters, food banks, animal health services, restaurants, breweries, just to name a few, are all considered essential. While the spread of COVID-19 in New Hampshire has not reached the level of other nearby states, we are putting ourselves in a strong position with these proactive measures to slow the spread of the virus. This order outlined today instructs Granite Staters to stay at home unless absolutely necessary. And while we appreciate that many in New Hampshire have been following our recommendations and have done a commendable job at practicing social distancing, today's steps elevate our message to Granite Staters that they should stay at home unless absolutely necessary by codifying it in this emergency order. Additionally, the state will be closing all state beaches along the seacoast effective midnight on Friday. We cannot stress this enough. You should stay at your house unless absolutely necessary. Of course, it will not prevent you from leaving your home to go on a walk or when heading to the store or if you need groceries or simply going to work. But beyond essential necessities, you should not be leaving your home. These are tough decisions. They really are. But at the end of the day, we know that the worst may still be ahead of us. And I have the responsibility of doing what is right for the 1.35 million Granite Staters in our great state. It will take sacrifice, but New Hampshire is resilient and we will get through it. The stay-at-home order will be effective until May 4th, 2020, and in order to align with our previous orders, we're extending our remote learning order also until May 4th, 2020. This continuation will provide teachers, parents, and students the ability to plan ahead for the coming weeks. Finally, we're taking great steps today to ensure childcare and daycare facilities remain open and accessible for our essential workers in answering the call to serve. In coordination with the New Hampshire Charitable Foundation, the state has crafted an innovative public-private partnership that will ensure that essential workers have access to childcare in an environment that is safe and comports to CDC guidelines. I'm going to now turn it over to Health and Human Services Associate Commissioner Chris Tappan to provide some of the details. Chris.
Thank you, Governor. As always, and certainly at this moment, we understand childcare is an essential two-generation approach. Helping parents work and children thrive is important to all Granite Staters. And we recognize childcare professionals are a critical part of our emergency response to COVID-19. I've had the opportunity to speak with many childcare programs and parents over the last couple of weeks through phone calls, webinars, and email. Your feedback has and will continue to inform our emergency childcare response system. We're embarking on a solution that works for providers, families, and employers now, while considering long-term options for that may become available to New Hampshire through further federal coronavirus stimulus packages. I'd like to highlight a few of the many strategies we're working on, as well as what we've accomplished to date. First, as Governor Sununu mentioned, New Hampshire Charitable Foundation will support New Hampshire's Emergency Child Care Collaborative, a partnership between DHHS, DOE, and child care professionals, advocates, businesses, and philanthropic leaders. The collaborative will establish a system of emergency child care for New Hampshire's most essential workers during the COVID-19 pandemic. The collaborative will be coordinated by the Charitable Foundation Early Childhood Director, Christina LaChance, and myself. We want to thank the Charitable Foundation for their support and dedication to helping New Hampshire's children and families get through this crisis. The collaborative will be focused on 3 key areas identified in partnership with providers: safety, funding, and infrastructure. Second, DHHS has committed $4 million from the Federal Child Care Development Fund for additional costs associated with operationalizing an emergency child care system, which will put resources directly into our child care programs to support staff, operations, and parents. Last, we're working quickly to respond to child care providers' questions and concerns. Yesterday, to help answer child care providers' COVID-19 related health and safety questions, a virtual discussion with Dr. Benjamin Chan, state epidemiologist, and Beth Daly, administrator for the Bureau of Disease Control, was held with 300 child care providers and stakeholders. To help support the financial stability of child care businesses, DHHS is coordinating a webinar next week specifically for child care professionals with the Community Development Finance Authority, New Hampshire Departments of Business and Economic Affairs and Employment Security, and philanthropic partners. Both webinars will be recorded and can be found with an abundance of other resources on our Child Care Aware New Hampshire website. Our goal is to respond to provider, employer, and parents' needs for safe and dependable childcare through a coordinated matching process. For questions, you can call Child Care Aware New Hampshire at 1-855-393-1731 to let us know about your needs. Again, I can't thank our partners, employers, and parents enough for their flexibility and willingness to develop solutions as we all navigate these uncharted waters together.
Again, we want the folks of New Hampshire to really understand that we don't take any of these decisions lightly. Disrupting daily life in New Hampshire should be something that is only done in the greatest of emergencies. But with the anticipated surge in hospitalizations, now is the appropriate time to take these unprecedented steps. And although we've built a system to handle the potential Plan C by utilizing the clinical flex surge facilities we've set up across the state, we hope the steps we're taking today ensure that we never get there. With that, we can open up for questions from the press.
Governor, can you just describe how you're thinking evolved on this from where you were yesterday to issuing it?
Well, again, yesterday there was a call to action in terms of this concept of shelter in place. You know, we heard a lot of people say shut down the borders, you stop transportation, and none of that has changed. That is not going to happen in the state. We're not calling out the National Guard here to force people back into their homes. People have to understand that daily life does have to continue. In talking to our partners in Massachusetts and really understanding there's still so much economic flow between the two states, it made a lot of sense that in taking the next step, it was likely going to happen whether it was this week or next week or even the week after. We figured the sooner we could actually make those steps, both in terms of the ability to suppress the virus and also give families and communities the ability to plan ahead and understand what that dynamic is and appreciate the dynamic across the border, and which is why we've chosen to align it so closely with Massachusetts.
And what's the message to the people right now? They have essentially until, is it about 11:59 tomorrow? People might get anxious. So
sure.
Are you trying to avoid any kind of, what would be the message to the people right now?
Sure. So if again, you know, we've provided a lot of flexibilities, similar flexibilities you see all over New England. If you have any question about your business, whether it applies as essential or non-essential, you can feel free to contact the folks at the Department of Business and Economic Affairs. They have their hotline set up, so you can use that hotline as well, and they'll be there to answer your questions, you know, in terms of what might be, you know, where the flexibility is. But there's a lot of flexibility here.
Governor, more than 21,000 filed unemployment claims in New Hampshire last week. Talk about that and your message to those who are filing unemployment claims.
So I have to be honest, I think that number is actually higher than 21,000. I think that's the number being reported out of Washington, but if you include all the different forms of claims, all the different partial claims and whatnot, I think the number is, I mean, I have Richard Lavers here that can talk a little bit about those details, but they're higher and they're going to go higher. And that's an incredibly scary thought, frankly. You have a lot of folks that are having trouble just putting food on the table. It's exactly why we put those other provisions in place. You cannot be evicted. I signed an executive order saying you can't be foreclosed on, utilities won't be shut off. We want to make sure people do have those basic needs, but that's going to be very tough. Now, I guess the shiny side of that coin is it looks like folks in Washington are looking at the ability to, whether it is to increase the opportunity for the unemployment fund. They're looking at an extended and more fuller paid leave program than some people ever thought it was even imaginable. We don't know really where those options are going to come out, but working with our partners in Washington, D.C., the congressional delegation has been, I think, very good to work with. We've been talking on a daily basis about all of these different aspects. So Washington is stepping up. The $2 trillion bill is an incredible opportunity. It's just the next step, and I have full faith there'll be more steps after that. So whether it's for small businesses, whether it's for individuals, whether it's for state and municipalities in supporting their revenue losses and their cost to COVID, I think a lot of financial support is going to be coming out of Washington, D.C. It's unprecedented amount of money, as you know. You're talking about trillions and trillions of dollars, but these are completely uncharted waters in unprecedented times, so I appreciate them stepping up.
So, Governor, how does the stay-at-home order affect the functioning of state government and the expectations of state employees?
So, we've been able to move a lot of our state employees already to a telecommuting operation. Those who can work from home, we're allowing them to work from home. So we've put a lot of our flexibilities in, so we don't see the state functions being affected all that much, other than to say that, we are obviously trying to tighten our budgets. We're not laying people off or anything like that, but we are trying to tightening our budgets and providing the flexibility that we hope are being mimicked out in the private sector. And we have seen that. A lot of businesses are staying afloat because they can have people do their job remotely. This is about really limiting those folks that have the one-on-one interactions. The vast majority of the non-essential businesses we're talking about today have already voluntarily closed, right? It's movie theaters or bowling alleys, hair salons, things of that nature, tattoo parlors. It's hard to ask anybody to close a business, but most of them have actually already voluntarily closed. We're just codifying this with an executive order and making the people of New Hampshire know they really need to stay home, especially the elderly, those that are 60 or older, those that have complicating health conditions. This virus is real. It is taking lives. We know that the surge is still ahead of us, and whatever we can do to plan ahead and support those efforts, whether it's at the hospital association, local health care providers, communities, it's our job to make sure we're supporting those efforts across the state.
So will public safety officials, either at the state or local level, be empowered to ask people as they're going out and about under the conditions of disorder, like, what are you doing?
No, we don't anticipate people being harassed and asked where you're going and what are you doing. We think that the order is self-explanatory and the people of the state will abide by it. The people of the state have been doing a great job, taking the social distancing very responsibly. I think they've been doing a great job understanding their responsibility. But, we're talking about pretty significant actions, whether it's the idea that we are going to close all the Seacoast state beaches. That's a very significant action. That's one of the areas where we still saw not a lot of groups of 10 or anything like that. You saw a lot of individuals. They were doing their spacing, which was nice. But we want to make sure that as it gets warmer and as these crowds could get bigger, as they may come out of Massachusetts or Maine to use our beaches, it's going to be harder and harder to enforce. So what we're really trying to do is provide another tool in the toolbox for locals to manage their communities, but it isn't about an enforcement action at all.
Can you take us through on the testing front? You had said that was going to expand. We're getting a lot of emails to our newsroom from people who are saying, gosh, I took a test 7-8 days ago and haven't gotten a result. When will backlogs like that clear up?
So the backlogs are in the process of clearing up, and we suspect they'll continue to clear up over the next couple of days. For individuals, it depends if your provider may have sent that test to an outside of the state lab. I'm not sure where it might have gone. Any backlogs, or if there were a couple days wait at the public health lab, those should be cleared up very shortly. Dartmouth-Hitchcock has been continues to be a tremendous partner, and we suspect that as we get some more supplies in, again, they have the testing capacity, but as the supplies come into the state so we can provide things like the PPE and the swabs, that they'll be up to full capacity very shortly.
Governor, the state's congressional delegation sent out a letter to the FEMA administrator regarding delivery of those supplies. Very critical about the response. Examples of one request sitting unprocessed for 4 days, sending us gloves that are latex gloves that are unusable in the medical setting. You've talked a little bit about the FEMA response. I wonder if you could.
Sure.
say
So,
whether it's-
yeah.
Is it getting any better?
Well, the New Hampshire congressional delegation sent a letter very critical to the FEMA response, and I join them 100% in that criticism, frankly. I think FEMA is trying, but there seems to be a lack of communication in terms of making sure that we get what we're asking for in a timely manner. We have gotten a couple shipments in. I appreciate what they're trying to do in Washington. My sense is they're trying to really focus a lot of their efforts on New York and some of the hardest hit areas, and I can absolutely appreciate that. But that cannot be done at the expense and the management of all the other states and all the other localities across the nation. So whether it's providing a more fixed delivery schedule or something that we can actually build off of and anticipate so we can manage our flow, we're a little bit at the whim of, gee, we put another order in and we hope we get it tomorrow. The communication has been very difficult, and I've been on the phone directly with the FEMA administrator. I've been on the phone directly with the vice president. We've talked about these issues. I think they're trying, but it is still not there, and so the criticism is very valid.
So previously, when you talked about this stay-at-home order, and you had said one of your biggest fears was that people would start to disobey it after a certain amount of time, 5 weeks plus a few days. What is the state going to do if people do largely start to relax their approach and disobey?
So my concern over putting this type of order in place is still very valid. I'm still very concerned because we don't know how long this is going to take, right? If this were just we knew this was just going to be a few weeks, I think that's very manageable and a very reasonable expectation for families and individuals to continue their social distancing, their work sacrifices that we're asking them to make. We have it in place till the early May, so that's approximately, let's say, 5 weeks. It could go 8. It could go 12. Those are going to provide a lot of challenges, and those challenges are going to start getting greater and greater. So we're working on a couple different options and plans about how to help folks manage through that if it were to go long term. We don't have a fixed answer for you today, but we understand that that's going to be one of the most critical aspects. We're only a couple weeks into this, and the anxiety and the fear are there, and we share that. We understand people should have that anxiety and fear because this is so unknown, and we see what's happening in other parts of the world. We see what's happening in New York City. I mean, just a couple hundred miles away. We see what's happening in Boston, and we know that at some point we're going to hit those surges. This could last a long time. It really could. So we have to make sure that both the healthcare system can manage that, and I think we've done a fantastic job, frankly, with the National Guard, the hospitals, everyone coming together, really working a flex solution, these surge centers that we've been talking about all across the state. But more to the point of the question in terms of the individual. Asking someone to stay at home week after week, asking the remote learning to continue at least through May, maybe even through the end of the year. We just don't know yet, but we're going to at least give folks the time to plan through May. And asking businesses to potentially shut their doors, not just for 5 weeks, but maybe more. That's an incredibly big ask. You know, we have between 20 and 40,000 people that applied for unemployment just last week. That number will double or even triple or more. That's a huge sacrifice we're asking folks. Those are individuals that, for the first time in their lives, might not be able to put food on their table. And as a governor, I can't tell you how hard that decision is. But we have to also appreciate we need stamina. We're going to be in this for a while. There is an end game. There is no doubt an end game to this. But we do need to ask the people of the state to be patient, to be flexible. We're going to work with you, whether it's one-on-one, as a group, or as an industry. We are going to work with folks to hopefully provide some of that flexibility when and where we can to get through this. It's going to be a long haul. It's going to be a very tough journey, but we are going to get back. We are back on our feet. I fully believe that.
Governor, just a follow-up on unemployment. Do you foresee the state taking any further action at this time or down the road?
In terms of our unemployment, I got to tell you, I think our first efforts out of the gate on the unemployment insurance were fantastic. We really made it very, very broad up front in the hopes that we wouldn't have to take additional actions. I think we'll keep those in place for quite a while. We'll see what assistance might come from the federal government. We may need to adjust depending on what stipulations come from the federal government, but right now they're very broad. People should take advantage of whether it's our kind of the upgraded online aspect of what we're doing. Pick up the phone and call the hotline, the 271-7700. 271-7700. I want to make sure I get that right. Pick up the phone and talk to someone. There is a person at the other end of that line to help you walk through understanding that when people have anxiety, sending them into a voicemail or sending them into a lost system where they never get talked to can just amplify the problem, right? So we want folks to have that community connection, that one-on-one connection to answer their questions. But right now on unemployment insurance, it's very broad. We want everyone to try to take advantage of it. No changes in place, but they could come down the road.
Governor, with regard to essential employees, so are all child care workers considered essential regardless of, Do any child care centers have to close as a result of this?
No, I'm going to defer to Commissioner. I don't think there's any forcible closure of any childcare. Nope, I want to make sure that we got that right.
Great.
Yes, sir.
Governor, we're trying to get answers that, as other states are reporting deaths related to the COVID virus, it appears the turnaround time of determining a death was COVID-related varies dramatically from state to state. The question is, can the state of New Hampshire say that if somebody were to die today and have COVID-related symptoms, what would the time period be before we would know that that is officially classified?
So I can't speak for other states and what their delays may be. We did have the unfortunate first death with COVID here. We still have on a per capita basis, we're doing more testing than pretty much anywhere in our region, and we still have a lower rate of positive infection than anywhere in the region. But we know that could spike at any time. To your question in terms of the turnaround time, that's really a decision for the state medical examiner and the coroner to confirm the exact cause of death. Right now, we don't have a significant backlog there. We've actually made some pretty significant hires into that organization just about 2 or 3 months ago. So we don't anticipate long turnaround times, but again, I can't speak for other states and why those delays may be there. Okay, well, thank you all very much. We really appreciate it. Thank you.